another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal.
On today's episode, we are going to be talking about when it is safe to resume sexual relations with your partner after hip replacement.
Well, Brad, usually after surgery, I'm tired, especially if I've been operating all day. So I tell my wife it takes me a while to relax and get in the mood.
So actually what I meant was when to resume sexual relations after hip replacement if you are the person receiving the hip replacement.
Oh, that makes more sense. I thought that was a personal question someone emailed in.
Not appropriate. And this is actually a video that we've done before, and we're just kind of relaunching it with kind of a new take.
Okay.
So what do you tell your patients, Paul? Because this is a very common question that we get asked in the clinic, and actually we've had a bunch of comments on our YouTube channel saying, hey, can you answer this? I'm a little bit embarrassed maybe to talk to my surgeon, and that's maybe the first point.
It is. I mean, it's a sensitive area. I don't just mean anatomically, I mean emotionally. A tough question to ask. But you should ask it. Ask that of your surgeon. They have heard it before, okay? Your surgeon has heard this question before, so it's important to get their take on it. But I tell people that we, like any activity, we always approach it with caution, right?
Yes.
So the first thing that I worry about is the incision. The wound, you want that to be healed.
Yep.
Especially in an anterior approach where the incision is in the front, where that may be where more action is during those encounters. So you really want the incision to be healed. It takes about 2 weeks, I'd say, at least for the wound to heal. Okay, so we got to have the wound healed without any complications.
Yeah, and then probably the other one relates to the range of motion restrictions that are put on hip replacements. So depending on the approach and depending on your surgeon and depending on if anything unique happened during the procedure itself, restrictions are commonly imposed for 6 to 12 weeks. And that really is to avoid extremes of position. So either having a planted leg and externally rotating, or positions of deep flexion probably is the most significant one.
Sure. So for lateral posterior approaches, flexion, internal rotation can make the hip dislocate out the back.
Yep.
For an anterior approach, we worry more about an extension and external rotation.
Yep.
So you really want to keep the hip in a very neutral position when you do resume in the first time. So is there like a certain time you say, okay, this is it, 4 weeks, you can do it?
I don't specifically say that. I usually tell them 6 to 12 weeks, and like a lot of things, like return to sport and return to work, I say pain and common sense should be a guideline. So, kind of proceed slowly and go from there.
When a patient asks me, I'm like, what do you want me to say? Do you need a note?
Yes.
But it's common sense and caution. So for me, the wound, make sure the incision's all healed up good without any problems there.
Yep.
And you're comfortable, you're not in discomfort anymore in that area. And then observe those total hip precautions.
And what I think is important for healthcare workers too is avoid the maybe unintentional bias of being a bit ageist. So older people still are sexually active. So some patients say, hey, I'm old, but I'm not dead. And I'm like, yeah, I didn't think that you weren't necessarily having sex. That's obviously a very personal decision between two people. So yeah, I think it's a very fair question. And ask your surgeon, don't shy away.
And hopefully this video helps you, because we want you to ask your surgeon, but sometimes if you're in a teaching center, you've got the surgeon, the resident, 3 medical students,
a nurse,
and you've got a full room, and it's hard to ask that question. I can appreciate that.
Yep.
But if you do get the chance to, where you'd feel comfortable, definitely try and ask your healthcare provider. But these guidelines that we've given you hopefully will help you. Don't rush back into it. Make sure the wound is healed completely well, and really be careful with the positions.
Yeah, like maybe like a nice dinner, bottle of wine.
That'll start.
Okay, if you like this video, please like it and follow our channel.
And remember, you are in charge of your own health.
We'll see you next time.